So mouthing behavior refers to behavior when our kids take inedible objects and put it in their mouth to chew and to hold for a long time. So this is seen in a lot of our kids. This mouthing behavior is okay to be present in a child until 18 months of age. That is around 1.5 years of age. So if your child is over 2 years of age and is still doing mouthing behavior, then this is concerning. So watch this video to learn why they may be doing this and 4 tips on what you can do at home to help your child with this behavior. Hi, I am Prianka Evangeline, your internet speech language pathologist, and today we are going to talk about mouthing behavior. So when our kids are just born and babies and until they are 18 years of age, their brains are developing at a very rapid speed. So during the initial age, they have sensory motor development happening. So since their body is growing, their skull is growing, their jaws are growing. So the nerves here are growing, and these nerves require some amount of information and input from the environment to grow according to the function, that is the biting and chewing function, which is very important for the human beings. For that to develop, a little bit of chewing, needing to chew is seen more in kids at this age. But sometimes our kids who are a little bit older can also be doing this because they may have a slight developmental delay in their developmental period. That is, the sensory motor development stage seems to be prolonging. This can happen if your child is having any other difficulties in motor development or speech development or communication development or cognitive development. This behavior is present even in a little older kids around 4, 5, 6 years also, because they have certain oral needs that we need to help them with. So I'm going to tell you 4 things that you can do to help your child today in your house right now. The 4th thing is you can do is the most important thing. Stay tuned to watch that. So what are these things? Number 1 is to have a tray or a box of certain types of foods always available to your child for their snacks. That is, these foods include foods that are very crunchy and chewy. Examples can be popcorn, nuts and peanuts, breadsticks, tapioca sticks, carrot sticks, crunchy pear and crunchy apples, banana chips. And in South India, we have this sweet called kamar kattu, which is just an amalgamation of jaggery and coconut. All these foods are very hard and they require a lot of biting and chewing, which is very useful for our child's oral sensory needs. Reduce the softness in your child's food. Incorporate more hard and chewy texture of the food. Example, by not completely cooking and mashing up vegetables and rice. You can use some type of additional aids to give your child that oral chewing need, and this can be something that you already have at home. Like I had mentioned earlier about breadsticks. So you can give your child breadsticks which are very hard, breadsticks and rusk, to bite and chew and require more chewing and eating. So you can substitute this anytime your child takes a toy or takes a pen and puts it in their mouth, or a block and puts it in their mouth. You can remind your child this is not to eat, and then let's go get snacks, and then take them to that place where you have the different types of food available for them, and then take one from that and eat that, but not this toy. This is a toy which we should not eat. So you can remind them that. Otherwise, I'm sure a lot of you already have chewy tubes and other chewing sticks, etc. at home. So if you have that, try to put it like a necklace around your child. So whenever they feel the need to bite something or eat something, they can take that and chew instead. The 4th thing is to target these specific areas. Spend some time every day to give some massages as well as some oral movements to the mouth and the jaw area. So watch my video, I will link above here, on gum exercises, that is inside the mouth, as well as you have to do some exercises around the mouth. massages around the mouth, especially the jaw. So jaw is one of the most prominent muscles, and that when jaw is activated and when jaw is given some pressure, it deeply calms the body. And since jaw is also very important for eating, it is one of the strongest muscles also. So focus on more jaw related exercises and massages. Start by placing 1 or 2 fingers on the jaw, and not very slight but not very hard, but moderate pressure, and do circular movements of massages on the jaw in clockwise and anti-clockwise, and you can continue the same on all over the upper jaw and the lower jaw of the child. So this, we will be massaging the outside of the face. Also you will, if your child allows it, massage the inner surfaces also. But if your child does not allow you to massage inside their mouth, don't do it. Also, apart from motor functions, since I was talking to you about this being a sensory need, that is something that they have to feel, try to give your child lot of different tastes, like sour taste, like very pulip or imli taste, or very spicy taste. Give your child foods with these different types of tastes, as well as give your child different textures to eat. So some foods that is very soft, foods that is very sticky, like lady's finger or banana or tapioca, or foods that is very grainy or crumbly, like jelly, or like different fruits or different types of millets, in ball shape, in different shapes, to your child. So work on giving your child different tastes, different textures of foods, also in different temperature of food. So give warm, hot, cold. Take this period of your child's development whenever you give them food as an opportunity to introduce your child to various tastes and temperatures and textures and different food types, and also very hard foods. This will help your child in overcoming that sensory need faster. Okay, that's all for this video. See you in the next video. Bye.